I'm Clare McMurray. I'm one of the paediatric physios in Lanarkshire. I'm going to demonstrate some upper limb mobilisations, technique which you may use with your child if their shoulder is tight and you want to help improve the range of movement to allow them to possibly play a bit more successfully, or use their arm for helping with dressing, using it for writing, for control with their wheelchair. I'd like to go on now and demonstrate some upper limb mobilisation. So we would use this again where maybe your child's quite stiff round about their shoulders. You want to get movement into shoulders to give them a bit more freedom and a bit more opportunity to play using their arms more successfully. So if we start with the right upper limb, and this is a slow, again, a neural release mobilisation, so just take it nice and slowly, nice and gently, no big movement. So we're taking the arm, if we can, out into position away from their body and just in line with their trunk here. So that's shoulder movement out, then move down to the elbow. We want elbow to come out and straighten out the elbow as much as possible. Whilst doing that, you're maintaining an outwardly rotated position of the shoulder and then moving down to the wrist and to the fingers and hoping to get an open, thumb out from palm and fingers open and wrist back. So it's quite a number of components to this mobilisation. So I'll come back down and demonstrate that again. So first part is you're taking the arm out from the body. You're turning the arm into the outward rotation. You're wanting elbow extension, elbow straight, fingers and wrist open and back. Now at this point, you want to do that gentle movement. So you're wanting to keep the arm straight, keep it out, keep it open, but you want to do just a gentle pulsing movement. So 10 pulses. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then let go. Now with some children you can't get all parts of that, all component parts of that mobilisation. You may only get arm away, you might get some rotation out, and it might just become quite stiff and quite hard to get the stretch at their elbow. So don't pull, just ease out as much as you can. And remember, you're looking at the kind of neural tension component there. So you don't want to pull, you don't want to stretch, you want a release. And stop there. Now we did hoovering of the legs, and now we're just doing a hoovering movement of shoulder and arm. So arm against trunk. So if you think of the movement we did in the lower limbs, that kind of pistoning action. So you're taking the arm and gently moving the shoulder against the shoulder girdle and against the trunk, and you just move there until you actually start to feel better range of movement and easier to get freedom. So following the demonstration that we carried out of mobilising arm mobilisation, we're now starting to think how we can use the range of movement that we've achieved from completing that. So how can we make it active? How can we get the child to work and move and use that freedom that they've gained? I want to move into prone. So we're thinking now of weight-bearing positions, placing of the arms freer, you've got more range of movement, so then we can think of weight-bearing and thinking of activity in this position. So if you place your hands close into the child's trunk, close into you, and taking your fingers at the front of the baby's chest, and you're wanting to weight shift back, but bring their arm in, so you've got arm, elbow in line with shoulder, and head comes up, and the child will weight bear there. Now we want to weight bear and weight shift. So we're weight bearing and then we're making it more dynamic by getting the child to move over onto the right hand side and let their left arm be free to reach and play. And then we're slowly changing and we're taking weight onto the left side, which then frees up the right arm to play. So we've done a wee bit of play here in forearm prop position. Now to progress this activity, you could bring your child's legs up onto your legs or onto a support, to small wedge, and you want weight bearing, and then you're going to demand a bit more activity of the child's back muscles, hip muscles, and general extension, so it's going to be a bit harder, but it's the same movement, slowly onto the left to release the right, but coming up higher, and you're just directing that movement, waiting for the child to be active, to do something here, to play, to wave to mum, and down again. So having achieved a bit of forearm weight bearing, some weight bearing in prone, we're now thinking of, could the child weight bear on the right, sustain this position and play inside lying. So we're going to get baby's weight shifted onto the right hand side and the top leg flexed and tucked here. So nice side lying position. The baby's head will come up from a right shoulder and we can play here. So the right side that the child or baby's weight bearing on is a long extended side, extended long leg here on the weight bearing, and the movement is here. So the movement's coming up. You could direct the child to come up, head off the right shoulder and play here.